Welcome to the APDA's Let's Keep Moving series. Thank you for joining us today. We're happy to welcome everyone to this forum. And please, if you'd like, introduce yourself in the chat. We were really thankful that people submitted some questions ahead of time. But if you have questions as you go, you can always put them in the chat and we'll try to get to as many as we can at the end. Today, we're happy to have the kind of third part in our series on balance called Moving with Confidence, Balanced Strategies for Everyday Life. So if you haven't seen the other two, we started off with a little bit of information a few months ago about what's affected imbalance in Parkinson's. The last series was about balance training in Parkinson's, and now we're going to talk about some strategies to help with balance. So to do that, here at Boston University Center for Neurorehab, I have with me Teresa Baker. Teresa and I are both physical therapists here in our center, where we specialize in seeing people with Parkinson's and doing research related to Parkinson's. So with that, I'll pass it over to Teresa.
Hi, Sarah. Thank you so much for that wonderful introduction. And a big thank you to everyone who's here joining us today. We just enjoy this project so much, and we're happy to share with you. So again, I'm Teresa Baker, one of the physical therapists with Sarah and Tim Nordahl in the center. We are at the Center for Neurorehabilitation. We're on the campus of Boston University. This is our email, and so we'd be very happy if anyone was in touch with us. Briefly, by way of disclaimer, we do present these webinars for general information only and really should not be considered individual medical advice. So we really encourage you to be in touch with your physical therapist or your physician for information that's right for you. And just as Sarah shared, this is the third presentation in a three-part series. And these other two presentations are archived on our Let's Keep Moving playlist. It's on YouTube. So these are very easily accessible. And the theme with all three of them were different aspects of balance. And so I think you'll find these very informative and help give different background information, frameworks about balance. And Sarah presented some excellent information about balance training and different exercises that could be part of someone's program. So those are out there. For today's topic, though, we are talking about general balance challenges that people experience in day-to-day life, and then try to get at what are some strategies or ways to kind of work around this. And although we talk about it in a very general sense, this can be quite personal, and I feel like we learn the most from our patients and from the Parkinson community. So I wonder if any of the questions or any of the information that's coming out today, you yourself have experienced it, or you have a comment or a question, or very specifically, do you have a strategy that has worked for you? I just wonder, would you share it in the chat? Because I think that information would be so wonderful to hear and useful to all of us. Okay. So a big question for everyone in the audience or people who are seeing this program perhaps later on. Where do balance challenges typically happen for you? What aspect in life are you, where kind of what situations, where does it usually happen? I wonder if you would take a moment to kind of reflect on this, because the answers about where and how do balance challenges, or why movements are challenging for you, help all of us physical therapists, but perhaps yourself and also your family try to come up with strategies to kind of manage those challenges. So these are just some very broad examples, but you can see an example of, say, a train station, busy escalator coming up to a platform, people in different directions, crowded, or even, example of just kind of walking through a regular sidewalk, just in an, an open sidewalk in a city where people are sitting. Maybe there's a bus stop, but it's loud and people are coming from different directions. This other example, say in a hardware store or supermarket, or any kind of a crowded environment where there's a lot of people, the environment itself is visually busy or stimulating. So these are just some general examples of out in the community environment where people with Parkinson may find balance challenges. So maybe just ask you to kind of reflect on, where in your life are you finding sort of the most challenging balance areas. Balance challenges could very typically happen in a home environment. These are just two examples, but for example, something we hear a lot from the people we work with is struggle with balance of getting off of the most comfortable chair, which happens, has a tendency to be lower and maybe squishy and soft, or feeling that they're having some balance challenges when they do stand up and they have to just turn the corner around the coffee table. Some people, say the picture on the right hand side, would find a balance challenge in an area that's very narrow, doorways, closets, that kind of thing. Clearly, the balance challenge scenario is very personalized, but we recognize there's some common themes among people with Parkinson's, and these are some that we hear quite a bit. So I just wonder if you're kind of starting to think about where you have the most challenging balance environments, and that will kind of get us back to what strategies might potentially help manage those challenges. A couple other pictures here. What you see here is a gentleman is coming down a hallway where there's a turn leading into a stairwell. So sometimes people feel that transition, having to make a turn and then something else coming right at them, a narrow, say, environment leading into that turn. Some people find that transitional movements like getting in and out of a car are difficult. There's a little bit of a turn, and then there's kind of a transition between that stand to sit in somewhat of a tight, confined area. So again, a broad question. I think kind of getting the theme here is where in life is a challenging strategy for you if you're considering your movement out and about in the sort of community setting, and then also in the home setting. Um, so when it does come to challenging in balance challenges in a community-based setting, sometimes I think it can be helpful to break down the nature of the challenges if you can think about it in terms of the environment that you're negotiating, the task in terms of what you are doing or needing to do, and then you personally. So these are some examples. Clearly, some of these are more applicable to certain people than other people. But again, very, very curious to hear from the audience. In the community, some examples of environment challenges or aspects of the environment that lead to balance challenges. I think you can imagine yourself, and perhaps from the pictures you just saw, any situation where there's a crowded environment. So that parking lot, a store, a doctor's office, a pharmacy, out in the environment at large, clearly there's some unpredictability to movement that either you yourself need to make or the other people in the environment might make. You can imagine, someone who's just needing to stop to open a door to get into a pharmacy, or you're trying to cross at a crosswalk and you have to stop. If you're taking an elevator, you need to stop, but then you need to go quickly when the doors open. I think you can sort of imagine that nature of movement is challenging in and of itself. Sometimes out in the environment, the surface of what you're dealing with is uneven or perhaps changing. As you can imagine, a ramp leading into, say, your doctor's office, or a curb step that you need to make, or a curb cutout crossing the street where the cutout itself has kind of a bumpy surface. Um, Lighting when you're out and about in the environment, again, can be somewhat unpredictable. As an example, say in a movie theater where the lights are turned down, and you're still needing to navigate into where you're sitting, or a restaurant where the lighting is quite dim, or the opposite, a situation where you're walking into lighting that's fairly bright, or you've been in the doctor's office and now you're exiting the parking lot. So vision plays quite a role in terms of how we all navigate our balance. And so lighting itself can provide improved vision, or it could also be potentially challenging depending on the scenario you're dealing with. And so, in those sort of environmental examples of the challenge, again, these strategies are some possible suggestions, but I'm hoping maybe we can talk through other strategies people have used. Again, some of this a person or family together might have some influence over, and some things you don't have control over in your environment. But some ideas relative to environmental challenges, you might consider trying to optimize things to the extent that you can. For example, say, a Saturday parking area near a hardware store or a busy grocery store. As you can imagine, there's going to be an element of crowded, a lot of people in every direction. If possible, that's an opportunity to potentially go at off-peak hours to try to park either as close to a store as possible, or for example, some people prefer to park further away where they know that the area around their own car would not be crowded. Again, that sets up kind of a scenario where if you do park further away, potentially is a longer walk into the store, contributing to your fatigue, and that maybe we can talk about in the more individual section down here. This could be an example where a use of an assistive device might provide some additional support. And I want to come back to assistive devices in just a minute. When it comes to, say, lighting, hypothetically, if say you're in a movie theater and you still need to get to your seat, you don't have a lot of control over the low lighting. Is that an example where you keep a flashlight in your pocket or use the flashlight on your phone? Again, some of these strategies are going to be very personal to you, but keeping in mind of the elements that you find challenging will set up what strategies could potentially be beneficial. Another thing to consider out in the environment is what is the task at hand and what demands are kind of inherent in that task. For example, say shopping, where you will come out of the store with something that needs to be managed either in your hands or some version of lifting, carrying, turning to load into the car. It could be that for you, having to get into a store while keeping up a conversation with whoever you're with becomes its own distraction. So, in that situation, again, one of the potential strategies is can you minimize distraction or other things that are taking your attentional demands? Sometimes to focus on just walking from the car into the store, it becomes what you're needing to do in order to get into the store safely. And then being inside the store presents a whole other style of environmental challenges that, again, potentially strategy by strategy, you can kind of address. When we are talking about shopping or something where your hands are occupied, that becomes one less avenue of support, meaning that you could use your hand on, say, a carriage in the store or an assistive device. So, if possible, a strategy of using a crossbody bag depends on sort of how a backpack style goes for you, but something where you're able to carry what you need, but it still leaves your hands free to deal with the task at hand. Just some ideas of possible strategies. Um, I think your own individual, say, challenges or how your Parkinson presents for you is something very important to keep in mind. You know yourself, or potentially you know your person in your family. In terms of strategies, balance challenges out in the environment, what aspects of yourself or your Parkinson's could potentially be contributors? Again, some here, just there's some very common ones we hear from the people that we work with. For example, is fatigue something that influences your balance? If you know you have several errands in a row to do, is that something that's going to be more challenging for you? If so, potentially say using a pacing plan where you're planning to take a break or adjust, say, sort of the how many errands you have to get done might be something that works for you. For your Parkinson's, is your medication cycle something that comes on and then also comes off? If that's true, could you potentially plan to have the more challenging balance aspects of your day occur in the on cycle? Sometimes, a perfect plan is in place and then reality also sets in. So recognizing that we're not always trying to plan for the most ideal situation, but could that be something you use to your advantage, depending on how medication affects you? And then again, what balance challenges are part of your day? Again, vision is such an important part of balance. So for yourself, if you have glasses that you use for distance, but then you need different glasses, say when you're in the store looking at the items, again, kind of optimizing what is going to give you the best visual input and making sure that's something you have available to you. And then I'll also say confidence, your confidence in your own balance. For some people that have had challenges in that area or potentially have taken a stumble or a fall, confidence could be on the lower side. And that's something to recognize as a factor in how you're moving and how you're feeling about your own balance. So, again, it's something to keep in mind. And then recognizing where the challenges lie for you may also be where the strategies come into place. So that was a lot to kind of cover in a row. But again, these are just maybe some pictures representing, say, some strategies that people could use in an outside community-based environment. Trying to show here, say, a parking lot where it's not peak of Saturday afternoon. Again, a grocery store where it's a little bit less busy. Using some hiking poles to navigate a path that's relatively quiet. Say recognizing that you might need a seated rest in and among all your errands in the day, and so taking it, using that to your advantage. And again, I think people may have different strategies that they have used and would be most interested to kind of hear from everyone together. Um, when it comes to assistive devices, I will say that we have done a past Let's Keep Moving presentation specifically about assistive devices. And so I wonder if that's something that is maybe you think could be a potential strategy to you if you'd have a chance to say, take a look at that presentation. Assistive devices, there's such a wide variety. The major benefit is the assistive device connects to the ground. And so that widens your base of support and it makes it easier to maintain your balance. There are several different options, and among the considerations are, I think, personalized recommendations, trying out an assistive device really before understanding what might be their best for you. Working with a physical therapist is really something I think that would be in everyone's best interest if this kind of style support could help your balance challenges. The other thing I'll say is that use of an assistive device can be very context specific. Several people that I work with will say that they keep a rollator walker in the trunk of the car for when they're out in a longer distance walking scenario. They know that that's when they'll use it. Some people take a hiking pole or a walking stick or cane with them into certain scenarios and don't use it at all at other times. Sometimes the use of an assistive device or just the fact that one is sort of out and about is almost a signal to other people in the environment that this person might need a little bit of extra time. And it helps let them sort of be more aware and then maybe be sort of more aware of their own movements and how that affects you. So this is something that could be a strategy that's very useful, but again, personalized recommendations I think are the best way to go. Um, when it comes to balance challenges specific to walking, and again, walking clearly could be affected by some of those other environmental challenges that we were just talking about. Sometimes identifying what's the goal of the walking to get a little bit of a picture of what balance challenges are we talking about. For some people, getting out and about in general with walking feels challenging or it feels like they have to be very aware of their balance. For some people with walking, their goal is to use it as an exercise tool to get some of that recommended exercise. And so in that case, they're really trying to get increased speed or maybe increased challenge. So it kind of directs the focus of what the challenges are, maybe towards they want to make sure that they're in a very clear walking path. Maybe this is a case where they're using the treadmill and they're holding on the bars of the treadmill. Sometimes, say if you're talking about travel, the goal really is to enjoy the travel, recognizing that this will be terrain that's a little bit unpredictable. If that's the case, potentially a lightweight assistive device might be useful. Again, of course, with walking, the environmental challenges relative to, is this indoor walking? Is this outdoor walking? Is this a surface you recognize might be uphill? Those all play in a role into sort of understanding what are the balance challenges with walking, and then that kind of guides any sort of balance suggestions. And then again, back to the individual. With your walking pattern, is it something that you're very aware of your own posture? Do you ever feel like you're in kind of a forward posture and that presents a challenge with walking, makes you more likely to kind of lose your balance in a forward position? Are you someone that feels that you have shuffling when you're walking, or you experience freezing of gait, which is very much a specific topic in and of itself? And again, we have several Let's Keep Moving presentations in the past dedicated to freezing of gait, what it is, and but very specifically what strategies may or may not work for people. So these are definitely something to keep in mind. And again, a physical therapist would definitely want to work with someone if balance challenges while walking are something that you're dealing with. So that a lot of information relative to balance challenges that may happen out in the community, may happen with walking. But in this situation, I might like to just give a hypothetical scenario. Say you've been invited to dinner at a restaurant you haven't been to before. So this is out and about in the community in an unfamiliar place. So it's not your same grocery store where you know the routine that works for you. In this situation, what would you do? I'm curious what people in the audience have tried under these situations. And I recognize we're talking about a restaurant, but could you imagine this could be a wedding reception? It could be a new doctor specialist that you've never been to that office before. It could be a new gym that you're trying for the first time. But navigating in an unfamiliar environment. So even just taking a quick look at this hypothetical scenario, busy, a little bit crowded, not sure how much room is available for turning, unfamiliar. So again, with some of the strategies we've talked about in this scenario, what could somebody do? Again, different strategies may work well for different people, but could you imagine, say, contacting the restaurant ahead of time to get an idea of how close is the parking? How busy would it be when you're there for your reservation? If this is a situation where you find some support from using a cane and maybe you don't use it all the time, maybe this is a case where, say, you do use a cane. You take it with you because you just don't know, would it provide an extra layer of support? Is this a situation where you wear kind of comfortable, sturdy shoes that you feel the most confident in, and not maybe say fancy sandals that don't give you the same amount of support? Again, in a restaurant situation, it's different for everyone, but do you feel better and easily able to sort of sit at the chair part versus a booth, or do you say you enjoy the support a booth gives you? Do you know that if you've been sitting hypothetically, say, for an hour for dinner and it's time to get up for the bathroom, is that a situation where you may feel slower, may feel stiffer? If that's true, maybe you want to practice some sort of movement, kind of warming up, ankle pumps under the table before it's time for you to stand up. Or do the people that you're with know that that's a time that you maybe use an extra support in terms of somebody holding the chair while you're about to stand, or someone, say, going with you as you get to the restroom? Maybe they're the one that sort of leads the way through the traffic. Anyway, hypothetical scenario, but I just wonder, given some of the strategies that we're mentioning, could you think of a scenario out in the real world where these things could work for you? Okay. And then turning our attention to home-based environment. And so there's much of the same considerations in terms of the environment at home. What are the demands of the task? And then what challenges do you know that you sort of are personally experienced? And I know some have the same element as these challenges that are out in the community, but in home, obviously, there's some things that are quite different. It's your home. So some of the elements are much more familiar. And sometimes there's not that same level of crowd and people in different aspects, people moving in different aspects. However, in the house, sometimes there are fixed elements that you're not able to change. You know, for example, if your doorway from, say, the living room to the kitchen has a small threshold, perhaps potentially that's a home improvement project situation. But if it's not, that's an element that that you will have to deal with, that you don't often have you're not able to change. So if that's the case, then maybe that's the kind of situation where if you're tripping over the threshold into the kitchen, does that need, say to be painted in a special sort of color to bring your firm attention to that area? Is that an area where maybe you need a grab bar or handle or something that you could get very reliable support as you're transitioning from one room to another? There certainly can be the element of unpredictable at home, depending on pets or if there's children, grandchildren in the home. Again, at home, lighting plays a big role when it comes to, say, vision and the vision's influence on balance. And that's something that you may have quite a bit of control over, and may be able to change to ensure that you have good lighting. When it comes to, say, different sounds, like if you're someone that has a tendency to run for the doorbell, it could be the situation where you recognize that that is a situation you may have kind of a challenge with your balance. So then you're recognizing that's true and that you're just having to go at your own pace, even if the doorbell is ringing. Again, task demands when you're at home, there's such a variety. Something that involves lifting, carrying, changing sheets, taking something down to the basement. A lot of that is going to be challenging to balance in different ways. So recognizing what parts of those are challenging for you, and then again, if possible, trying to minimize the distraction, focusing on just one thing, not having someone talk to you with sort of extra distractions as you're going. Again, maybe having a plan before you start. If possible, having things in the kitchen that are at, say, waist high, even if, say, traditionally they used to live in the lower cabinets, maybe they could be in sort of the middle cabinets if that's the kind of thing that challenges your balance. If it's a transitional movements and you know standing up from that comfortable chair is challenging for you, first of all, I think you may need to incorporate some of these functional balance training exercises that Sarah was talking about in the previous presentation. Is that the kind of thing where you need to set your legs exactly the way you need them to make that transition? You need to have good arm support. Um, Thinking about again in the house, where are the balance challenges will lead you down the pathway of what possible strategies might work for you. And again, this is coming back to what personal um, kind of examples of balance challenges do you know relative to your own energy level, fatigue cycle, your own confidence. So keeping those in mind as you're trying to plan what strategies might work for you. And again, um, this is just kind of some examples of in the house, different strategies relative to having the surfaces clear of any sort of rugs or anything that you could possibly trip over. Um, Even if say that's a rug that's been in the house for 10 years, if that's a challenge for you at present, that might have to be adjusted. Um, Grab bars can be certainly an excellent stabilization strategy, especially in the bathroom or the shower, where you're definitely going to have a lot of transitional or turning based movements. And then sometimes even footwear as a strategy. Again, sometimes perhaps it's been your way to have house slippers, but if they don't have good support for you, or you're finding that that's its own challenge, it might be that a different style footwear, even in the house, is something that is going to provide more stability for you. Again, this is a home-based scenario. It maybe doesn't resonate with everyone, but for example, if it's the kind of situation where at night you know you're going to be up for the bathroom, you're tired, kind of groggy, this might be a part of your medication cycle where you sort of have the least amount of medicine in your cycle, in your system. So in that situation, what can you do to sort of optimize conditions for you? This is a hypothetical scenario, but if that were true, could you ensure that the pathway from the bed to the bathroom is free of clutter, and then you have kind of a straight pathway? In this situation, is it possible an assistive device, even potentially just for this one movement, is helps you in this scenario? Maybe it's the kind of thing you use a walker just to get to the bathroom at night. Lighting in the situation would be critical. It's something that is sort of a night light in the bathroom, or something that ensures that the pathway is well lit and it's not dim lighting that you're having to focus on. And again, grab bars are something that's very stable, to be a support hand surface, as you're just trying to get through what you need to get done in the bathroom at night. So I think some take home points, some similarities between the two environments out in the community and at home, identifying where are the challenges for you. Specifically, where are the challenges if you had to think about it or your family had to think about it? And then again, what conditions can you optimize? What sort of eliminations can you make in terms of distractions? What sort of additional supports would work for you? And then this is definitely something a physical therapist would be so helpful to work on these individual style challenges. And so that's kind of one of our strongest recommendations for everyone. But with that, we're here at Boston University, really through support of APDA, but this is our contact number. It's our toll-free hotline. This is our email, rehab@bu.edu. And it's the kind of thing where we would very much love to be in touch with people, specifically to help find physical therapists in your area that might really be a useful resource. And so with that, I hope we could bring Sarah back into the program. And I wonder if we could cover some of the questions that maybe came up from today.
Thank you so much, Teresa. That was great. I really love the scenarios. Those are really good examples of things that I think many people face every day. So thank you for including those, and thanks for everyone who's participated in the chat. We're going to try to kind of go with some themes here that we've gotten from questions ahead of time and questions in the chat. The first one being there were several questions. We had Paul, Jonathan, and Daniel all talking about balance with turning, trouble navigating corners or turning. What would you say are some kind of top ideas or strategies for that?
Yes, yes. I thank you to everyone who brought that up. Turning, as you know, presents quite a balance challenge because clearly there's a change in direction. There's often a head turn that's involved, and for some people, they find that destabilizing. Among several suggestions, one thing I would say is to slow down before you turn and try not to turn perhaps at the pace that you're walking. I know that sounds like a simple suggestion, but some people will just go right into a turn at their same cruising speed, and sometimes that's where balance becomes a little more unstable. The other thing I'll say is look where you're going into the turn. So your head and eyes are going to lead your body movement. It could be in these in that turning based situation, you do need a little bit more awareness of what the surface is. So if you're turning, you're able to look a little bit more down at the floor. But I don't mean to say that you should look straight down in turning. But it might be the situation where you do want to be more aware of what's going on around your feet. Um, for some people, their tendency is to move quickly, so their turn is quick, almost a pivot style turn. If that's the kind of thing that throws someone off balance, one of my suggestions would be to take a wider turn that might encompass more steps, but potentially make those steps steadier. And then again, this is very context dependent, but if there is a railing or you're using an assistive device, that might be additional support to use as you're turning.
Thank you. Yeah, I think we again try to troubleshoot individually in physical therapy, but a lot of those strategies, slowing down a little bit, making the wide turns, can be really helpful. That might lead in. We did have several previous episodes about freezing of gait, but we also had some questions on freezing of gait being a problem for balance and maybe some strategies that could go along with that. So I know wide turns, again, is one that we often coach people to try to use when they have freezing, but can you think of some others that help people with freezing not lose their balance so often?
Absolutely, absolutely. And that it's such a challenging scenario where a person is experiencing freezing of gait, which may contribute to sort of decreased balance. Often that sort of revs up anxiety, which is sort of another contributor to decreased balance. My first suggestion would be to try to stop the forward movement and not fight through the freeze. I know that also sounds simple to say. Sometimes that is very difficult in practice, but to stop forward movement and then to try to initiate movement either very deliberately. What you could use is some of these other strategies where you're either self-coaching your first step. You're maybe imagining stepping over something. Sometimes what people will do is take one single side step and then try to go forward. Some people will try several marching in place movements and then turn that into a forward step. Something that's sort of a very deliberate, you bring your mental focus to initiating the first step to try to get some further momentum. Again, some people with freezing of gait find assistive devices to be helpful. That's very personalized, but that might be something to consider. Sometimes people are also, they can kind of use sort of visual information to their advantage. For example, if it's a crosswalk, the way the lines sort of are, sometimes people watch the flow of those lines and they're able to get their steps to be a little more smooth and steady. I will say for people with freezing, sometimes you recognize in and of yourself situations that are very triggering for your freezing. And sometimes some of my patients have said they stop ahead of time, they try to let everyone else go ahead. They take their time, they don't put pressure on themselves. So those are just some suggestions. But again, some of our past information and definitely working with a physical therapist are my top suggestions.
Yeah. And I think those are all really good suggestions. We could also talk briefly about like the environment. You know, you mentioned that in some of your slides, is that if you're someone who freezes, take a look in your environment if there are certain tricky spots and see if you can modify your environment to make it a little bit less triggering. So widen spaces, remove clutter, um, have less changes in surface, things like that can also be helpful if you have that opportunity. So I think we're going to go in all directions, kind of freezing, thinking about losing the balance forward. We talked about turning. Now we have a question from John, and we had one before from Daniel about losing balance backwards, that backward stepping or backing up can be a big challenge, which we do know. And I think Tim mentioned some specifics about why that is in Parkinson's. So
Yeah.
any strategies when you have to back up, but you know it's going to be a challenge?
Yes, absolutely. And interestingly enough, that happens so often in regular life. Just even, considering, reaching in for, say, the yogurt in the grocery aisle and then sort of stepping back to get to your own carriage happens for sure in the house quite a bit. So I think, first of all, recognizing that that is a challenge for you. Again, this is very context specific, but if possible, to potentially have hand support on a very stable surface. Again, maybe this leads a little more to sort of in the home environment. And by stable surface, talking about something that is a fixed situation. So the counter, a wall, a door frame, um, not say a chair that's going to move on you. It could also be that with backing up, again, recognize this is a little easier said than done. You recognize that that is something that is challenging so for you. So say if you're the one putting groceries away in the kitchen, that you don't have someone talking to you at the same time, that is what you're focused on. I will also say that backing up often happens in a single step or two. So sometimes people will even try to take a slightly longer backward step, land it, and then land the next step as well, almost like a very deliberate, say, 1, 2. I recognize that's getting a little specific and that potentially doesn't work for everyone, but as much as you can, a stable surface, hand support, and then your focus on what you're doing when you are backing up.
And I've had people have some success too with that kind of 1-2 strategy, but also adding a little bit of lateral movement. So it's almost like a diagonal or like a little bit of a dance step where you're not just going straight back, you're kind of adding in that shift and that lateral movement, depending on the person, can be helpful.
Yeah.
So you mentioned some really helpful tips about when there's visual challenges, so, turning on lights, making sure glasses are checked, things like that. Wonder if there's anything else that you could point out. Clay had a question about for someone who has some visual impairment or visual difficulties related to the Parkinson's, what options are there?
Yeah, I take your point. And again, of course, it's different for everyone. But for example, say if someone is wearing glasses and there's a bifocal component and they have to go up a curved step or down a flight of stairs, that can be extremely challenging based on sort of the visual input mismatch that they're getting. In that situation, I think, again, full focus on what the person is doing. And I recognize that a curb step doesn't necessarily have anything to hold on to. So it might be in that situation that the person is deliberately looking down, taking a very deliberate step, trying to ensure their foot clears the curb, lands on the curb. If we're talking about a staircase situation, it might be this situation where the person is definitely on the railing side of whatever staircase they're talking about. It could be that your typical way on the stairs is step over step over step, but say in this hypothetical going downstairs where you're not sure you're seeing the step, you might have to take it step together, and that's a slower way to do it. There's no question about it. But again, it's bringing a little bit more awareness to the specific challenge that the person faces. The other thing I'd say is be in regular contact with either your ophthalmologist or whoever supports you for vision, because things could potentially be adjusted in your glasses that maybe gives you sort of just a clearer, sharper visual focus. But taking the point of the person asked the question is that visual information is so important to our balance. And so it's worth all the time and effort to try to have as much support in that area.
Absolutely. Thank you for those extra tips. I think one area, again, I think you covered so much related to this, but it's just worth revisiting a little bit and talking through is that losing balance when you first stand up or when you quickly stand up. That was Donna who brought that up, is she loses balance often if she stands up quickly. And I know you gave that example in the restaurant, but I wonder if we could revisit some of those or if there's anything else that comes to mind to help with that. I mean, I think the first thing that comes to my mind is try to take your time when
Yeah,
you're going to stand up.
yeah, yeah,
Easier said than done
yep.
often, but always taking your time, giving yourself a few seconds to transition, checking in and seeing how you feel. But Teresa, I'll turn it over to you and see
So
what else you have.
absolutely, that would definitely be my top suggestion as well. Again, this is personalized to everyone, but if some people are dealing with blood pressure changes and they when they first stand up, that's quite noticeable for them. Sometimes that can be addressed with different compression style stockings or garments or what have you. Sometimes before if there's enough pre-planning to recognize that, say you've been at the movies and now you know you're going to stand up. Sometimes some leg activity, especially in the ankles or the lower legs, to try to get some sort of even muscle contraction to help sort of with blood flow return. Again, Sarah, to your point, as soon as the person is able to stand up, to not rush and to try to keep holding something, maybe for a moment longer than feels necessary to try to ensure you have your balance, potentially to even explaining that to the people that you're with. So it's not a situation that, say, at the dinner table or restaurant, they expect you to jump up and ready, everybody leave all together, that you might need a moment or two. Again, this does take some extra pre-planning. Sometimes it feels like a lot to manage, but the payout is pretty significant, and these small strategies can make a big difference.
And I think one thing about these strategies is at first it feels like a lot to think about, but if you pick one or two activities to work on and you use it over and over, then it becomes more of a habit than a strategy, right? That's what we hope is that in this example, if you're taking your time, say widening your feet before you stand, taking, a minute before you start walking, if you do that over and over, it won't be something that you have to think about. What are those steps I have to do, right? It will just kind of become your habit and your way, and your balance will kind of thank you for it over time. So I think we'll probably hold there. I know we didn't get to every question, and we read all your questions and we really appreciate you entering them. But we're not able to answer every one on here. If you do have questions, you're always welcome to send us a message at rehab@bu.edu. That's our APDA exercise helpline email. There's also a phone number you can call and talk to one of us or one of the other therapists that we work with to try to help come up with solutions that work for you. So I do want to put in a plug. We'll be back here in October in the fall, if you can believe it. We'll be shifting a little bit away from balance to talk more about walking and how to incorporate some brisk walking into your activity. So we're going to talk about putting some pep in your step in our next edition. And we hope you'll join us for that. And we hope you'll follow us this channel on YouTube so you can see some of the previous episodes. And again, Teresa, thank you so much. This was so helpful and informative. And I learned a lot myself, and I hope our audience did too.
Sarah, thank you so much. Thank everyone to the audience. We appreciate the support of the APDA, and we will see you next time on Let's Keep Moving.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.